Hi everyone, my name is Katie Brumfield and I am with the Colorado School of Public Health. I am the Career Services Specialist there, and today I'm going to be sitting down and talking with one of our alums. Meagan Cain graduated from our school in 2015 with her concentration in community health education from our UNC campus. Hi Meagan.
Hey, nice to see you, Katie.
So Megan's going to talk to us today about her career. Megan, if you wouldn't mind just starting off telling us your job title, where you work, and whether it's some big projects you're working on or your day-to-day. Sometimes it's easier to talk about bigger projects or day-to-day, whatever works for your career path.
Yeah, absolutely. Well, thanks so much. And first of all, I'll just say that everything that I'm sharing in this interview is strictly my own personal views and doesn't necessarily represent those of the CDC. That's just my little intro. But yeah, I'm happy to tell you more about myself. So I currently am based at CDC headquarters in Atlanta. I'm within the Division of Global HIV and TB. So specifically, my role is that I'm a health scientist on the gender and youth team within yeah, there's so many acronyms. I don't know if I'm going to get carried away here. But I work within HIV prevention. So in my role as a health scientist, I serve as a technical expert for gender-based violence, as well as issues surrounding youth. And so my work is just global. So while I'm based at CDC headquarters, the technical support and assistance that I offer is to our CDC offices overseas. And we have about, I want to say about 32 different country offices around the world. And so my work is primarily based in sub-Saharan Africa. And so as a health scientist, I really focus on responding and preventing gender-based violence. So there's certain populations that are more at risk of gender-based violence, and one of those populations is adolescent girls and young women. So a lot of the programs that I assist with are addressing the root causes of both violence and HIV. We really think of them as dual epidemics because individuals who experience violence are more at risk of becoming infected with HIV, and those who are infected with HIV are also more at risk of experiencing gender-based violence. So without getting too technical, we work on implementing programs that address some of the root causes. So we do programs that are very layered. Interventions are very multifaceted. So we might address things around keeping girls in school, making sure they have access to sexual and reproductive health services, while also addressing some of the community structures, educating the community about violence and HIV, maybe also involving parents and parenting programs. So it's these programs that are very kind of layered, and they work together because there's really multiple risks that these girls face. And so that's a big piece of what I do, and my passion, and it's been my passion forever, is really post-violence care and response to gender-based violence. So I work on providing technical assistance to our clinical partners who provide post-violence care. So we kind of have a package of different services that we might offer at a clinic for somebody who's experienced violence, in particular sexual violence. And so this might be things like post-exposure prophylaxis to prevent HIV, STI testing and treatment, and different things like that. So while I'm not in any way a medical expert, I really focus on the program pieces. So how can we do better services? How can we make our services more accessible and more friendly to younger people, maybe to people who live in rural areas? So while I focus a lot on program, a lot of what we do is also informed by research. So I hope I'm not just babbling on, but
No, this is great.
Research. Yeah, I think it's exciting. I love talking about it. But sometimes you almost have to be like, okay, back to reality. So some of the research we do is around measuring violence and what violence looks like in a country. So for instance, some of the surveys that we work with are called the Violence Against Children surveys. So if you're interested in learning more about those surveys, you can Google Violence Against Children through Together for Girls. And so what those surveys are is we do population surveys on the prevalence of violence, the experience of violence, how many people under 18 will experience sexual violence. But then we also do research into really the way that violence occurs, right? So the time of day, the places it occurs, where are the perpetrators? And so that information that we gather can then help inform our interventions. So it's very nice, a pairing of program that's actually informed by our research. We call it really that data to action. So my day-to-day is kind of in a weird place right now with COVID. Usually I would spend about 60% of my time overseas in different African countries. And that's really a big piece, selfishly, of what drew me to this work, is that I love to travel. I love to try new food. I love to meet new people and new cultures. And so being able to go to different countries and experience that and make those relationships with our country colleagues is probably my favorite part of the job. I can tell you that I have not been on a plane. I'm having some major plane withdrawals since about March. I was in South Africa when things really started to pick up with COVID. So I've been here at home, but because we live in a world that's becoming more and more connected, I'm still able to do my work. So I'm able to offer this kind of support remotely. So my big project right now is I'm training our country staff, as well as the partners that we work through on the ground, to be able to train providers to respond to violence, to be able to identify and also to provide a compassionate response to violence. So over the last, I want to say, maybe 2 months, we're just starting to wrap up. I've trained about, I want to say about 300 people across 15 countries using a Zoom platform, actually practicing how you would respond to somebody about disclosing violence, the signs and symptoms, and how to recognize violence, and also how to appropriately identify it by asking questions. And it's been a really great experience. And I think it's been an example of some of the adaptations that we've had to go through as COVID has become a big part of our world. And so a big part of my focus is really, because we know violence has increased during COVID, how our services can best adjust to meet those needs, how we can use new technologies while recognizing that a lot of the populations that are impacted by violence face the most barriers to getting help, to actually having access to technology. So we're working with our partners to be very creative and ensuring that our services are still meeting their needs and they're still able to keep running. So that's kind of I'll say that's a little bit of what I do.
That's amazing. I mean, I'm always blown away by public health professionals and their careers, but it sounds like you have the dream job for a lot of public health professionals.
It's been my dream job. You know, I kind of always had this end goal in mind, and now that I'm here, I'm so happy. And I think about like the path that I took, and that it wasn't always like a straight path that I was going to go straight global health, that sometimes you kind of have to weave around and get different experiences, but it was definitely worth the journey.
So let's talk about that. How did you get where you are today? Walk us through after graduation. What positions did you take, and how did you apply for this position?
Yeah, you know, I'll say I started this path, you know, way before graduation and throughout my UNC career. I specifically chose community health education because I saw it as something that was really valuable both locally and abroad, and that I saw it as something that's very practical. So while I knew that I was going for global health, I knew that I also needed to have courses that I could actually put things into practice. So instead of thinking theoretically like, oh, let's pretend we're in an African village and how would we implement this? Because planning and actually implementing something is totally different. That at UNC, I was doing projects where I was going into the community around UNC and really and actually implementing these projects. And there's actually a lot of global health within Colorado because we have a lot of global populations that live in Colorado. So it was good to know that I didn't have to, you know, travel across the world to get global health experience. So right after I graduated, throughout UNC, my time as a master's student, I was teaching sexual health education to high schoolers. And I think if you can work with high schoolers, you can kind of like work with anybody is what I learned. But after that, I was also working on an HIV project in Denver doing biobehavioral surveillance with high-risk populations. So this was very related to the HIV work that I would end up going into and actually doing that field experience of doing interviews with people who were high risk and getting them tested for HIV. So following that, before I was even done with my MPH, I had applied to a fellowship. So the particular fellowship that I applied to was called the Alan Rosenfeld Global Health Fellowship, and it's done through ASPPH. Mm-hmm. So I applied, and I knew it was going to be really competitive, so I was kind of trying not to get my hopes up, but I was accepted, and I was actually accepted for a position on a team that I still work with now as a full-term employee. So we're still like working together, and I had great mentors. ASPPH, I believe, is no longer offering this specific fellowship. They offer a number of fellowships, but it was taken over by the Public Health Institute. And so, you know, if you wanted a similar experience or to learn more about that, you would, I'd be happy to provide more information, but that would be PHI.
Perfect. There are a lot of fellowships out there, and I love encouraging students to apply for fellowships. How did you decide on which fellowship was best?
That's a good question. I could say if somebody's interested in the CDC, that there are a lot of fellowships, but that is good news because it's very competitive. And so the more fellowship options, you know, if you're able to apply to as many as possible, that would be my advice. I had actually heard of this fellowship before, but I guess I felt like a little discouraged. I don't know. Throughout my life, I have really bad imposter syndrome. And so, you know, I was looking at this and I was unsure, and it was actually a mentor through the Colorado School of Public Health that really looked into it and said, this is for you. You have to apply. And so I'm forever grateful for her. She was so right. So I applied to this one. At the same time, I also applied to Presidential Management Fellows. It's called PMF. So, and that at the time, I think it's changed, but I remember it being a pretty intense process, you know, where I had to go to DC and do all these in-person, like different drills, and, you know, all these different kind of almost like personality tests. And I remember that also being an intense process. And in the end, I was offered both fellowships, but I decided to do the Alan Rosenfeld Fellowship just because it was very program-based and very, very at the level of the field and the work that I would be doing with working in sub-Saharan Africa, but also working on family planning work was something that really related to my passions.
How long was your fellowship?
So ASPPH, I want to say, and I'm trying to remember the boundaries of where ASPPH ended and PHI then took over because I was a fellow in both programs. So for ASPPH, I think I was a fellow for 2 years, and then for PHI, I was a fellow for 1 year.
Oh, wow, that's cool that you could extend it with PHI.
Yeah, you know, it was great. They kind of just like continued the fellows on, and fellows provide like so much important work for the CDC, and it's such an amazing opportunity because it really focuses on people who are right out of their master's degree. Yeah. And I know the feeling of like when you just graduate and you're trying to enter a field and there's so much expertise and it's so intimidating. But that time that like as you're graduating is when you kind of have a lot of special opportunities. So you're not competing with people, you know, who've been in the global health field for like 50 years and they know everything. It's really, they particularly want, you know, kind of these fresh new students right out of school to like quickly build their capacity as health leaders. So yeah, a fellowship is a great way to go.
Yeah, I can't recommend it enough. I think fellowships are a great experience. And most of the time I hear stories like what you're saying is that then they got hired on afterwards. I know that's not a guarantee, but I know that that's very common.
Yeah, yeah. I mean, it's definitely not uncommon. It doesn't always work out. And I know when I was throughout the fellowship, they said, you know, we'd love to keep you. And the hiring process for any government agency is very intense, and it doesn't always seem to make a lot of sense. But yeah, I was able to continue, and I absolutely would not have been able to get hired without doing the fellowship, because I'd made those relationships with the people in our branch. I helped, even though I was assigned to particularly the HIV testing team, I knew I wanted to do gender work. So I connected with another team who was doing gender work. And I said, how can I also be involved in your work? So they started giving me some of their projects. And that's the team I actually ended up getting hired onto. And I'm continuing the work that I actually started as a fellow, that I was, you know, doing these projects around improving the quality of post-rape care. And I'm still working on it all these years later, because I was involved in the project at a really critical time where, you know, I was the one doing it and leading it, and they needed it to continue.
That's amazing. And such a great experience.
It was great for me.
Yeah. But such a huge, great experience to get right out of graduation.
Yeah, I feel really lucky. I had a lot of good mentors and support systems along the way.
Nice. If you had to pick 2 or 3 things that the Colorado School of Public Health really helped you prepare for your career, or maybe things that you still use today, what would be those courses or skills that you learned?
Yes. So I'll say the specific track that I was in, community health education, has proved so valuable. I feel that it's something unique that I bring to my branch in the CDC. I work with a lot of people who are incredibly brilliant, that I would say probably genius when it comes to medicine and epidemiology, and how they're able to like work with data. And those are all skills that I'm working on, but I'm not an expert. But I feel coming in and really having an appreciation and a knowledge around community engagement, the importance of cultural competency and cultural humility, and how you engage the populations that you work with, and not just engage, but meaningfully engage. And some of those concepts that have been really hammered into me are something that I use and that I bring to the table. You know, so sometimes when there's protocols to review and, you know, it might have a violence component, I know I'm able to go, you know, these are some of the concerns, like how can we make this safer? Are we adequately engaging the people who need to be engaged? And so that mindset is something that I will never get away from, and I'm so grateful for. I'm trying to think of other things. I mean, it was really a culture of mentorship that I got at UNC. I had a number of individuals, not just in class, but we'd spend time after class and they'd say, you know, what are your goals and how can we get you there? And I'm somebody who's kind of had a hard time opening up or reaching out for help. And it really got me to that point and that realization that I need to seek those people out, and that those people are going to help make me successful. And so that kind of mentorship model is something that I'm like really, really always striving to find, and that I've been able to continue it and also find those folks out at UNC. I'll tell you, it's funny. I took some classes around like program implementation and evaluation, where we're actually, you know, worked with the health department to design a survey and actually implement it. And I felt like I learned so much from that class of actually doing it. And so that same year, there was the opportunity to do the case competition. And so I actually like pulled on my notes from that class. I'm like, I'm going to use this for the case competition. And it ended up being so helpful, and how we like structured our logic model and everything, that we ended up winning the Colorado case competition. And then we got to go to Emory. We didn't win at Emory, but we got to meet a lot of connections. And I actually met people that I work with now who are at that case competition, because Emory is where the CDC is, and there was a lot of CDC folks there. So a lot of those connections I was kind of making as a student before I even really knew.
That's so cool. I love the case competition.
Yeah, it's a lot of fun.
It's such a good competition.
Yes. Oh my gosh, it's so fun.
It's
Yeah.
so fun.
Oh my gosh, it's one of my favorite things. Yes. And especially if you win.
Yeah. And how cool you got to go to Emory and do a case competition there. That's so cool. That's great.
No, it was so fun. You know, it's funny, like I'm thinking of mentorship, that now also I get to be a mentor myself, and I love doing stuff like this, talking to students, but I also have grad students and research assistants that I get to supervise, and I try to be as good of a mentor as mine was to me, but I just love it. It's kind of become like who I am.
Yeah, that's so cool. What advice would you have for someone that is interested in doing global work and they don't really know how to get there? Because I feel like I get that a lot from students, and I don't always know what to say.
Yeah. I would say that is the most common question. Global health is something that I think there's a lot of interest and a lot of passion to do, because like, why wouldn't you want to travel and go to these amazing places and try to like have these impacts? I think global health is really, really amazing, and that there's a lot of interest in global health. And I know that when I was seeking out global health opportunities, it sometimes felt like the door was kind of being shut in my face before they even knew me at all. They're kind of like, we're full. We're full. We have enough global health, or, you could consider doing something else. And I can say that if global health is your passion, do not let anybody tell you that there's not enough room for you, that we're full up, because there is so much to be done in global health. And I think more than other places, you have to be incredibly resilient, and you have to know where your passions are. Seek out those opportunities. Maybe maybe you have a very specific idea of what you want to do in global health, and an opportunity comes along, and maybe it's not exactly that, but I can tell you that having a little bit of that experience, it goes a long way. Even if you're passionate about HIV, but there's a chance to work on measles, do that, because a lot of the same principles around working with diversity and program planning and all of that is very transferable. I'll say that global health, I feel in a lot of ways is very, it's a privilege to work in. And I mean that because I know I myself was able to do projects abroad because I was able to get funding, or I was able to put in some of my own money. And I realized that not everybody has that experience to travel to Africa or to like self-fund themselves. That in a way, global health is very privileged. And so I think global health has to itself do a better job of being more diverse and representing the people that belong in global health. But I also think that there's a lot of local opportunities within global health, that there's you don't have to travel across the world to do global health work. I did a lot of work with the Refugee Center in Greeley, working with Somali women and talking about things like female genital cutting. And in my job today, female genital cutting, child marriage, it's still something that I'm working on. So I would find things that are local that could easily translate to a global context. And I say that passion goes a long way. Experience is important, but you're never going to be the most experienced person in the room, as I've realized being at CDC. So where you lack in experience, you can make up for with passion. It's just, there's a lot of opportunities out there, and you might have to be crafty and be creative, but you can draw a lot of parallels between global work. And I can say when I've been hiring students to work for me, I'm much more impressed by somebody who has taken an issue, maybe sexual violence, and they've done work like on their campus, in some kind of small town, and they're passionate about the issue, versus, somebody who was able to go on like a study abroad, at our project site. I think you can build those skills locally, and I don't think you should be discouraged if you know in your heart that global health is what you're supposed to do.
those are probably the best tips of advice I have ever heard for global health. That's amazing. I love it because it's so true. I mean, there's so much here we can do,
Yeah.
and passion in public health is a huge piece of why you even get into this career field.
Exactly. I mean, none of us are in public health because we hope to be rich one day, right? Like, oh, well, you're going into public health because you're really passionate and it's something that you enjoy. And my issue is that, you know, they say when you love something that you never work a day in your life. I think that's very true, and that I sometimes have trouble separating, like, this is work and like, no, this is, you know, I need to not do this because I love, like, if I can read an article on, you know, the percentage of men who have sex with men who are experiencing violence in Nigeria, I'm like, oh my gosh, like this is so interesting. And so if you pick something you love, you know, you'll be able to do it well because it's your passion.
Yeah, I love that. Very good advice. Yeah, it's great. All right, well, we know you're very busy, and thank you so much for your time and sharing your expertise and knowledge and career path with us. This has been amazing. I hope everyone has learned something. Yeah, and thank you for all the great public health work you're doing.
Absolutely. Thanks for having me.
All right, thanks, Megan. Bye.